Welcome back. I'm here to help you understand autoimmune diseases and the medications we use to treat them. Today we're diving deep into Arava, also known by its generic name Leflunomide. If you're a patient who's just been prescribed this medication, or a healthcare pro looking for a solid refresher, you're in the right place. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. Arava is a disease-modifying antirheumatic drug, or DMRD, and it's designed to dial down the immune system. It's FDA approved for rheumatoid arthritis, but we also use it off-label for conditions like psoriatic arthritis and lupus. How does it work? Arava blocks an enzyme called dihydroorotate dehydrogenase. That slows down pyrimidine synthesis, which your immune cells need to multiply. So, in effect, it helps calm the overactive immune response by targeting those fast-dividing, inflammation-driving T cells. Arava comes in pill form and is usually taken once a day. Most patients are on 20 mg daily, although some start with a 100 mg loading dose for 3 days, but that's controversial due to side effects. It's important to know that Arava takes time. It can be 4 to 6 weeks or longer before you start feeling the benefits. That's why we sometimes pair it with steroids at the beginning to manage symptoms while the medication ramps up. When it comes to effectiveness, studies show Arava holds its own against methotrexate. It can reduce joint inflammation, slow down joint damage on X-rays, and improve daily function. It's a solid option, especially for those who can't take methotrexate due to side effects or medical reasons. Like any drug, Arava isn't without its drawbacks. The most common side effects include diarrhea, nausea, hair thinning, elevated liver enzymes, high blood pressure, and rash. But we also watch closely for serious issues like liver damage, bone marrow suppression, interstitial lung disease, and birth defects. Yes, Arava is highly teratogenic. That means it can cause serious harm to a developing fetus. And here's the kicker, it stays in your body for up to 2 years unless we actively wash it out with cholestyramine. This matters not just for women planning pregnancy, but for men too. Because of these risks, monitoring is key. We check your labs before you start, CBC, liver function tests, and hepatitis B and C screening. Then we repeat blood tests monthly for the first 6 months and every couple of months after that. We also monitor blood pressure regularly since hypertension is a known side effect. Arava can interact with other medications, especially warfarin, which can increase your INR and bleeding risk. We also avoid combining it with other liver toxic drugs, live vaccines, or alcohol. So who shouldn't take Arava? If you have active liver disease, a history of serious infections or bone marrow disorders, are immunocompromised or are pregnant or trying to be, it's not the right fit. If Arava doesn't work for you or causes issues, there are alternatives. Methotrexate, sulfasalazine, biologic DMARDs like TNF inhibitors, and newer options like JAK inhibitors. Sometimes we even use Arava together with methotrexate, but that requires extra monitoring for toxicity. Here's what I always tell my patients starting Arava. Be patient, it takes time to work. Stick with your lab schedule, it helps us keep you safe. Report any new symptoms, especially cough, rash, or yellowing of the skin or eyes. And if you could become pregnant, reliable birth control is non-negotiable while on this drug. Arava is a powerful tool in managing autoimmune diseases. With the right precautions, it can make a big difference in controlling symptoms and preventing long-term joint damage. If this was helpful, don't forget to like, subscribe, and share with someone who might benefit. Drop your questions in the comments and I'll be happy to answer or cover them in a future video.